Hey ladies, welcome to GOC Grace channel once again. It's time to explore more about your body in just a few minutes per day. You can take control of your health and well-being. It is not advisable to take care of your health on your own. Consult with a doctor for advice. On this post, we will talk extensively on body image. Body image refers to a person's perceptions, thoughts, and feelings about their physical appearance. It encompasses how individuals see their own bodies, how they believe others see them, and how these perceptions affect their self-esteem, identity, and overall mental health. A healthy body image involves having a realistic and appreciative view of one's body and accepting its capabilities and limitations. Conversely, a negative body image can lead to harmful behaviors and psychological distress. Historical context and evolution. Body image ideals have varied significantly across cultures and historical periods. Ancient times. In many ancient societies, such as Greece, physical perfection and symmetry were celebrated, but body size did not always carry the moral or health implications it does today. Renaissance era. Fuller figures were often idealized, symbolizing wealth and fertility. 20th century. With the rise of media, beauty standards became more homogenized. The flapper era of the 1920s celebrated thin, boyish figures, while the 1950s admired curvier shapes like Marilyn Monroe's. Modern era. Globalization and digital media have created rapidly shifting ideals, often promoting unrealistic standards, for example, extreme thinness, muscularity, or perfectly contoured features. Influencing factors on body image. Several factors influence how individuals perceive their bodies. A. Media and pop culture. Media representations, including magazines, TV, movies, and especially social media, often promote narrow beauty standards. Edited, filtered, and idealized images can create unrealistic comparisons, especially for adolescents. B. Family and peer influence. Parental attitudes, especially critical comments about weight or appearance, can profoundly shape body image. Peers also play a role through teasing, comparisons, or reinforcement of beauty norms. See cultural and societal norms. Different cultures have different ideals. While Western societies often emphasize slimness, other cultures may value larger bodies, seeing them as signs of health, status, or fertility. D. Gender expectations. Women commonly face pressure to be slim, toned, and youthful. Men often feel pressure to be tall, muscular, and lean. Non-binary transgender individuals may struggle with dysphoria or societal pressure to conform to binary gender ideals, complicating body image issues further. Each psychological and biological factors. People with anxiety, depression, or low self-esteem are more susceptible to negative body image. Additionally, hormonal changes during puberty can affect how adolescents see themselves. Types of body image. Positive body image. Accepting and appreciating one's body, regardless of societal standards or imperfections. Negative body image. Feeling shame, anxiety, or dissatisfaction about one's body, often linked to distorted perceptions. Distorted body image. A cognitive bias where individuals perceive their body differently than it objectively appears, often seen in eating disorders. Body neutrality. A movement focusing on what the body can do rather than how it looks. Consequences of negative body image. A persistent negative body image can lead to a range of mental and physical health problems. A. Mental health disorders. Eating disorders, including anorexia nervosa, bulimia nervosa, and binge eating disorder, body dysmorphic disorder (BD), a condition where individuals obsess over perceived flaws. Depression and anxiety, often associated with poor self-esteem, rooted in body dissatisfaction. B. Risky behaviors. excessive exercise, cosmetic surgery obsession, use of steroids or diet pills, self-harm. C. Social and emotional impact, isolation and withdrawal, difficulty in relationships, impaired academic or job performance. Body image in specific populations. A. Adolescence, puberty changes, peer pressure, and identity formation make teens highly vulnerable to body image issues. B. Adults, life changes such as pregnancy, aging, or illness can shift body image, often creating new insecurities. C. Athletes, athletes may experience pressure to maintain a certain physique, sometimes leading to a condition known as relative energy deficiency in sport. Red S. The role of social media. Social media amplifies body image issues by encouraging constant comparison, promoting unrealistic beauty through filters and editing, influencer culture emphasizing unattainable lifestyles, fitspiration and thinspiration trends, which may masquerade as health but promote disordered thinking. However, social media can also be used positively through body-positive influencers, inclusive representation, and supportive communities. Body positivity and acceptance movements. The body positivity movement emerged to challenge harmful beauty standards and promote self-love. Key goals include celebrating all body types, promoting diversity and representation, encouraging media literacy, fighting fat phobia and weight discrimination. Closely related is body acceptance or body neutrality, which focuses more on functionality than appearance, helping people shift focus from how they look to what their bodies do for them. Strategies for improving body image. Media literacy education, understanding that most images are edited and curated, can reduce their impact. Mindfulness and self-compassion, learning to observe thoughts without judgment and treat oneself kindly. Therapy and counseling. Cognitive behavioral therapy (CBT) is effective in treating body image disorders, surrounding oneself with positive influences, friends, media, and role models who support diverse bodies. Avoiding body-shaming language, changing the narrative from criticism to care and acceptance, promoting health over appearance, focusing on wellness, strength, and self-care rather than aesthetics. In conclusion, body image is a complex and deeply personal aspect of human experience. While society and media have historically imposed narrow beauty standards, growing awareness and advocacy are creating space for more inclusive and healthy perspectives. Building a positive or neutral body image is not about conforming to any ideal, but about cultivating respect, care, and appreciation for one's body. Long-term solutions involve not only individual changes, but systemic shifts in media representation, cultural attitudes, education, and mental health support. A society that values all bodies is one that supports the well-being of all its people. Therefore, we advise that it's okay to ask for help and support when you're struggling with anything that concerns your body. If you need additional information, don't hesitate to ask. See you on our next post.